The Cri-du-chat Syndrome is a rare genetic disorder, but it is a common syndrome caused by chromosomal deletion. The term Cri-du-chat is a French word which means cat cry or call of the cat. It is a chromosomal condition that results when a piece of chromosome 5 is missing. It is also known as 5p deletion syndrome, 5 meaning the fifth chromosome and p meaning the p arm of the chromosome, which is the short arm above the centromere. Other names include cat cry syndrome and monosomy 5p. In 1963, a French geneticist, Jérôme Lejeune, recognized several patients that had similar characteristics, one of which was a high-pitched cat-like mewing cry. He named the syndrome Cri-du-chat because of that distinct characteristic. Lejeune and his peers karyotyped individuals with the disorder and found that they were all missing a piece of chromosome 5. Majority of the cases of deletion happened de novo, which means that the genetic alteration presents itself for the first time as a result of a mutation of one of the parental germ cells. The remainder of cases are due to familial rearrangement, mosaicism, rings, or de novo translocation. Translocation happens when one of the parents is a carrier of a chromosomal abnormality, which can be present in several generations of the same family. Most cases of Cri-du-chat syndrome are not inherited. Affected people typically have no history of the disorder in their family. About 10% of people with Cri-du-chat syndrome inherit the chromosome abnormality from an unaffected parent. In these cases, the parent carries a chromosomal rearrangement called a balanced translocation, in which no genetic material is gained or lost. Balanced translocations usually do not cause any health problems. However, they can become unbalanced as they are passed to the next generation. Shown in this image is a high-resolution physical and transcription map that has been generated on a 3.5 megabase region of 5p15.2 that is associated with the Cri-du-chat syndrome. There are several correlations made between genotypic events and phenotypic expressions. First, deletion of 5p15.3 leads to cat-like cry and speech delay. Next, deletion of 5p15.2 results to distinct facial features associated with the syndrome, as well as severe mental retardation, which is associated with hemizygosity of beta-catenin. Hemizygosity is the state of having only one of a pair of alleles transmitting a specific character. Finally, telomerase reverse transcriptase or TERT gene mapped at 5p15.33 and haploinsufficiency of telomere maintenance also contributes to the phenotypic changes in Cri-du-chat syndrome. This telomerase reverse transcriptase is required for telomerase activation in various human cells. Telomerase is a ribonucleoprotein that stabilizes the telomeres of chromosomes in actively growing cells, and the ability of a cell to divide over an indefinite lifespan may require the expression of telomerase. Here are several patients exhibiting the clinical features associated with the Cri-du-chat syndrome. The first patient is an older child who has a long and narrow face due to the disorder. The next case is of an infant. It is notable that the patient has a round face with full cheeks, hypertelorism or widely set eyes, epicanthal fold, which is a skin fold of the upper eyelid that covers the inner corner of the eye, extending from the nose to the eyebrow, and low set ears. The last patient is a 2-month-old baby with the syndrome. The clinical features of the Cri-du-chat syndrome may manifest either during infancy or in childhood up to adolescence. Notable clinical features during infancy are the following. First, the characteristic mewing cry due to the narrowness of the larynx. This is observed as a high-pitched monochromatic cry with subtle dysmorphism and neonatal complications which are commonly observed in infants. Loss of the characteristic by age 2 years occurs in one-third of the children. Also, the child may exhibit hypotonia or weak muscle tone, microcephaly or small head size, severe cognitive speech and motor delays, hypertelorism, strabismus, which is a condition in which the eyes do not properly align with each other when looking at an object, micrognathia or an undersized jaw, and short fingers. On the other hand, during childhood or adolescence, it is notable for the patient to experience premature graying of the hair, a short philtrum, malocclusion or misalignment of the teeth, hypoplastic nasal bridge, small testis but normal spermatogenesis in males, hypersensitivity to sound, and autistic-like features and social withdrawal. It must be noted that the last feature is more characteristic of individuals who have a 5p deletion as the result of an unbalanced segregation of a parental translocation. Prevalence of this pathology is 1 out of 20,000 to 1 out of 50,000 and is one of the more frequent chromosomal deletions. Cri-du-chat syndrome usually happens by chance, but in 10 to 15% of cases, it's inherited. Most individuals with Cri-du-chat syndrome have a normal life expectancy. Diagnosis of this disorder is based on the syndrome's distinctive cry. Physicians look for the physical signs and problems that usually come with the cry. A cranial X-ray may reveal any problems with the shape of the base of the skull. Confirmation can be done through genetic testing. While there is no specific treatment available for Cri-du-chat syndrome, early intervention is recommended in the areas of physical therapy, communication, behavioral modification, and learning. Because symptoms may vary from individual to individual, it is recommended that parents discuss these options with a healthcare professional to develop a personalized plan for therapy. The survival for children with Cri-du-chat syndrome is generally good. Most syndrome-related deaths occur within the first year of life. Several children have lived to be over 50 years of age.